Haikal. New day, new hope for improving millennium outcomes and maternal child health and reproductive health services. Promoting institutional delivery is a critical element for achieving improved maternal and newborn care outcomes. An MCH nurse attending to a newborn case of a Haikal Safe Clinic facility in Bow City. Over the years, their rate of attending counseling meetings and demand for family planning commodities and services have overwhelmingly increased. The health facility in Bow District is located in Kakwa Chiefdom to serve more than 4,000 people in the catchment area. Also in Makbaraka, the facility is located in Kwalifa Ruwaila Chiefdom and it serves over 4,000 people in the catchment area. The community, also having recognized the bold strive taken by Haikal, have provided security for the entire health facility as part of their own contribution in protecting the health commodities. At the Bow Health Facility, 70% of the deliveries take place after midnight when the nurses are called from their homes to deliver the women. For referrals after normal hours, pregnant women wait for hours before coming to the clinic, which lead to complications during labor. Activities: teenage pregnancies. Haikal carries out outreach activities to raise awareness among teenagers and adolescents for the prevention of unwanted teenage pregnancies. Haikal has also supported school clubs in sexual and reproductive health education in both the North and South. Family planning. Haikal is involved in counseling women, teenage and adolescent girls on abstinence to increase their level of awareness and knowledge on the prevention of early pregnancies, STIs, HIV and AIDS. This is done through community outreach programs, radio talk shows, jingles in local languages, and supporting community advocacy groups and community mobilizations, referral for obstetric fistula prevention, and setting up pregnant women support groups among targeted communities to enhance institutional delivery for the prevention of fistula and other maternal morbidities. Based on the strategies adopted, very good results have been achieved towards improving maternal and reproductive health issues, especially obstetric fistula. Through outreach and social mobilization campaigns for community sensitizations, at least 40,000 rural communities across the 4 targeted districts have adequate education, information, and communication on obstetric fistula prevention, institutional delivery, family planning, HIV and AIDS, nutrition, and Ebola-related women's reproductive health issues. Also, at least 200,000 vulnerable women and girls in the targeted areas have been reached out with the adequate information in the mentioned thematic areas. Under 5s. Haikal provides healthcare services including vaccination, prevention of mother-to-child transmission of HIV and other STIs. This in-depth intervention by Haikal, with support of partners including UNFPA and World Bank, is worth commending in the area of women's health and the way Ebola has negatively impacted on the national health system. In spite of the resource mobilization challenges, there is still greater need for continued support towards women's health issues in Sierra Leone.
As you can see, this project needs to be sustained, as fistula needs to be sustained. Because one reason we are talking about fistula, I'm in the area of fistula, and talk about the prevention of fistula. This is the beginning of how fistulas are prevented. Because we are encouraging young girls. As you can see, most of our girls are very, very young and are teenagers. They're coming here. We We have a counseling place where we can counsel them. Then we have a family planning area. Then we are talking to them to encourage them to come to the clinic. Institutional delivery is the key to what we are fighting for. If we can encourage these women to come to the hospital or to come to the clinic to be treated until the baby is born, we can avoid so many fistulas. And even the fistula patients that we have are also coming here to be treated. The children are healthy. They are coming for their immunization. Women with HIV are coming. Family planning are coming. We're doing all of those activities here. Nutrition, children with kwashiorkor are being treated. So we need support from the government. We need support from the World Bank, and most of all, we need support from the from UNFPA.
This documentary was put together by Haikal as part of the World Bank funded activities executed by UNFPA and implemented by Haikal.